Welcome everyone. We're so excited for you to join us for Where Do I Start? Advice from medical and adaptive sports providers. We're really excited to host this session as the second of our three-part Adaptive Sports 101 for Parents series. And while we're waiting for the last few folks to join us, we'll go over just a few housekeeping items. The first, all participants will be on mute just to minimize distractions. If you would like to ask a question, please feel free to click the Q&A button on the bottom of your screen. There will be an opportunity for Q&A at the end of this session, the last 15 to 20 minutes, with our panelists. So please feel free to submit your questions anytime throughout, and we'll get to them at the end. And then finally, we will be recording this webinar for you and others to tune into at a later time. So we strongly encourage you to share with your communities and anybody who you think could benefit from this. Before we turn it over to our wonderful panelists, one of the questions that parents are often asking is, how do I find and connect with a local program? And if you're not familiar with the Move United membership network yet, the Move United membership network is made up of 164 organizations providing adaptive sport opportunities across 43 states currently to individuals of all ages and abilities. And to find a member organization local to your area, you can visit moveunitedsport.org or connect with us directly and we can help you get set up. Now, I'd love to turn it over to our panelists here and let them tell you a little bit more about themselves and what their involvement is in the Adaptive Sports Network. So KJ, I'll have you start if that's all right.
Absolutely. Hey there, everyone. My name is Kaja McEwen. I work with the Spalding Adaptive Sports Centers, which is affiliated with the Spalding Rehab Hospital on the eastern part of Massachusetts. So north of Boston, all the way down to Cape Cod. We have 3 different locations and coordinators on each of those locations, which are both clinical professionals as well as adaptive sports specialists.
Awesome. Thank you, Kaja. Katie, I'll turn it over to you.
Sure. My name is Katie Jolie, and I'm the Sports Association Program Manager at Gaylord Specialty Healthcare. Gaylord is a long-term acute care hospital as well as has several PT clinics in Connecticut. My program is based in Wallingford, Connecticut, and we have a year-round program of about 15 different sports. My background is as a certified therapeutic recreation specialist. So I've been in the field for about 20 years and I've been in this role for about 7 years.
Awesome. Thank you very much, Katie. And Megan, we'll turn it over to you.
Hello, I'm Megan Welty, the manager of the Sports and Recreation Department at Courage Kenny Rehabilitation Institute in Minneapolis, Minnesota, formerly known as the Courage Center. And we also have an office that runs adaptive sports up in northern Minnesota, based out of Duluth as well. At Courage County, we are a full rehab hospital. So we have everything from inpatient, outpatient programming, driver's assessment and training, adaptive sports, the whole gamut. So lucky to be here today.
Awesome, thank you. And then Kathleen is not yet with us, but if she has a chance to jump in, we'll have her introduce herself when she joins us. And thank you again to all of our panelists for joining us. What's really special about everybody who's here is that they have the experience of not only working in the adaptive sports field, but also being affiliated with a rehab hospital and connected with medical professionals. So thank you for joining us. And to get started, we have a few questions we'll ask our panelists, and then again, we'll get to that question and answer at the end. So before we get started, we'd love to get a sense of who is with us. So in a minute, you'll see a poll appear on your screen. And if you could just take a minute to complete that poll, that would be great. All right, a couple more seconds here. Awesome. So it looks like we've got a good mix. We have several adaptive sport providers, some parents with us, some athletes themselves, some medical professionals, and others. So that's really great to see. Thank you all for joining us. So now we'll go ahead and get started. The first question that we'll cover is, as a parent, where do I even start? And KJ, if you want to start off with this question, that would be great.
Sure. I think a great place to start is with what you know, who you know. As a parent, you have a medical team, whether it's your pediatrician or a physical therapist, occupational therapist that knows your child. It's a great place to start. Most folks at least have some connection or understanding of what adaptive sports are, and might be able to connect you with programs in the area. Or is it a teacher? Is it your local phys ed program? Some other places to start might be a local cycle shop. I know we, as Spalding Adaptive Sports, we have relationships with all sorts of providers in the Eastern Massachusetts area, whether it's related to kayaks or cycles or rock climbing gyms or anything like that. So if you're interested in exploring a sport for your child, go to some of those places and say, have you heard of? And they might be able to recommend a place to go. And certainly I would be remiss not to mention something like Move United, trying to find, Googling adaptive sports in your area or finding it through the Move United website. Google is an incredibly powerful place to start a search. And then if it's beyond your umbrella of what or who you know, maybe contacting some of those recommendations and then narrowing your search to more local. One of my pleasures of working in this industry is how collaborative everybody is, and there are many adaptive sports providers in the Boston, greater Boston area, and we are constantly referring parents or individuals to other groups. If we don't provide a sport, or if somebody else has a better robust program in, say, sailing or rock climbing, we'll say, hey, call these folks, call Waypoint, reach out to this person or that person. And I think everybody might find that there's information out there. You just got to start with who you know.
Awesome. Thank you, Kaja. And I think you bring up a really great point about the Adaptive Sports Network, that it is truly very collaborative. Everybody's in it for the same reason. Thank you. Katie, I'd love to turn it over to you.
Yeah, sure. One thing that's unique about working as part of a rehab hospital is that if you are a parent, your child has gone through an injury, later in life, and they are part of a rehab network, we're able to start introducing adaptive sports right here at Gaylord with our inpatients. We have a team of therapeutic recreation specialists, as well as our adaptive sports program. Some of our on-site programs, we're able to incorporate inpatients that are here in the hospital in those programs. So it's a really great place to start. Or if you're a parent looking for a rehab program, that might be something to consider, is if they do have either therapeutic recreation or an adaptive sports program. And then we get to see people kind of transition from inpatient, move into our outpatient clinics, and then be part of our community adaptive sports program, which is open to anyone in the community, not just our inpatients and outpatients. And then, as Kaja was saying, I have people coming to me all the time asking for, I'm interested in this particular sport, where can I go? And we're always referring out. Like, if we don't offer it here, if I don't know of a place, I can usually come up with it or find it, or work through the connections that I have to be able to help people and guide them in the right direction. So finding a local rehab hospital, would be a great place to start. If you want to do more searching, at least in this area, I've found that some of our park and recreation departments do have some adaptive programs, so that's a nice place to start, as well as YMCAs. Some YMCAs are also becoming more adept at having actually adaptive fitness coordinators within their programming. So those are another two good organizations to start with.
They're great. Thank you, Katie. Megan, I'll turn it over to you.
The only other thing I really have to add is I know in our area we host a Discoverabilities Expo every year, where we literally bring together all the different adaptive sport programs from across the area to come in and give folks an opportunity to meet face-to-face, meet the coordinators, try out the equipment, and give it, just to get an understanding, which it's just one way to reduce those barriers where you get to actually meet the people that are going to be working with your child. And so that's been a huge hit. So looking for opportunities like that in your own area. Sometimes it happens at a local school with their special education programs or their adaptive PE programs. Or like you said, like the YMCA sometimes might have things, or park and recreation districts as well. But that has been a really great way for us to be able to highlight all the different opportunities that are out there for adaptive recreation in the area for parents to learn more. So.
Awesome, very neat. Thank you, Megan. And it looks like we've had Kathleen join us. So Kathleen, I don't mean to put you on the spot, but
That's
I would
okay.
love I'd love for you to give us a quick introduction about yourself and your involvement with Spalding. And then we'll pose this question to you as well.
Great, thank you. Hi guys, apologize for being late. My name's Kathleen Salas and I'm a physical therapist and I run year-round programs north of Boston. I'm affiliated with Spalding as my colleague Kasia is. I'm late because today my clinical hat is on. So I specialize in working with clients with neurologic deficits of all ages. And currently, including yesterday, we are running some programs for cycling and wheelchair tennis and archery. That's currently what we're able to offer. So I think I know what question we're on, but why don't you prompt me and I'll add, I think you've probably already heard a bit, but I might add a little bit.
That's perfectly fine. Yeah, so we were just discussing the first question. As a parent, where do I start when looking for different programs?
Yeah, and I heard, Katie, what you were recommending, the local YMCA. The caveat I might remind folks that's happened in our region is that the Y or a Boys and Girls Club will be advertising an adaptive sport. Rock climbing comes to mind, swimming comes to mind. And then when I have families reach out, they'll say, well, our staff member is specialized working with kids on the autism spectrum. And that's wonderful, but if your child has a physical disability, then it may be a barrier that they may not have a staff member that's specialized in that particular disorder, or they may not have specialized equipment. So I find that more often than not in our region, that some of the gyms are very comfortable with children and adults that might have hidden disabilities, but not as much experience with certain physical disabilities. So that's an important caveat. That doesn't mean they're not willing to learn and have me come in and support them and show them some of the tricks. The other types of organization that came to mind for me are things like, it used to be called ARC. So kind of these umbrella organizations that can support when children are older, looking for a job, looking for school, for transitional services. So some of those more, Easter Seals is another really well-known one. So sometimes there's somebody in those offices that has a special interest in recreation. But I think those are the two other ones that may not have been mentioned already.
No, those are really great points. Thanks, Kathleen. And I think everybody's mentioned some really helpful resources. And one of the things that stood out from what you said, Kathleen, is that sometimes you do reach out to organizations and they don't necessarily have the staff that are equipped to work with your child or your athlete. But what you guys do a really great job of is then collaborating to provide some of that training and information to help them be successful. So I know that's a point that was brought up prior to you joining often, that collaboration is just key in the industry. So thank you. All right, so the next question we'd love to discuss is, what considerations should I have in mind when looking for a sports program for my child? So that could mean health considerations, physical, equipment, things, anything along those lines. And Katie, I'd love to pass it off to you to start this time.
Yeah, sure. Gosh, there's so many things that I thought of that could fall into this category. But I think one of the first things is, trying to figure out if that program is going to be able to meet your child's needs. And some of the things that you can be asking that program is, do they have specialized adaptive equipment for youth? That's a big one that, specialized adaptive sports programs usually do. But as Kathleen mentioned, programs like the YMCA or Park and Rec might not have that specialized equipment, or it might be for adults but not children. Children's adaptive equipment is fit and a smaller size, obviously, to meet the needs of a child. Other questions are, what types of people participate in that program? I know for our program at Gaylord, we serve individuals with physical disability or visual impairment. So knowing what that program serves and the type of individuals would definitely be a consideration to make sure that they can meet the needs of your specific child. And then what kinds of staff are involved in providing the program? Do they have recreation therapists, physical therapists, occupational therapists? Do they have specialized volunteers? And do they have an instructor of that sport? I know, for our programs, we usually have a professional instructor of a sport along with certified therapeutic recreation specialists, and sometimes we do have some physical therapists who are volunteering with the program. So those are definitely all kind of important, I think, first steps to look at. And the other big one, I think, is safety. That's a big one that we've all kind of had on the forefront of our mind with Safe Sport, and making sure that the program is able to protect the safety of your child, especially if it's a team sport. Knowing what Safe Sport is, and does the program do background checks and Safe Sport training to be able to protect youth from any types of misconduct, verbal and physical.
Awesome. Great. Thank you, Katie.
Sure.
Megan, I'll turn it over to you.
So I think just kind of starting from the get-go, it's understanding your child and what their interests are. Are they into individual things? Are they competitive? Like what makes them and gives them that spark and joy when they think about sport? So starting with the interest, and then kind of piggybacking on what Katie had mentioned of what is the criteria to play. Depending on the Paralympic sport, there's different criteria. And one of the things that we always are seeming to educate parents is that even though your child might be ambulatory, they could still participate in a wheelchair sport depending on what their disability or diagnosis might be. And so being open to trying new things, oftentimes it's just giving it a try first and seeing if it's going to be a good fit, and that is a big part of adaptive sports is we adapt, we kind of figure it out. And so just being open, working with your child to give it a try. And the location and time commitment is also a really big one. Some activities are more competitive than others, and also take a pretty big financial commitment as well, depending on the sport that you're interested in playing, if you have to travel a lot. For example, like our competitive wheelchair basketball teams travel across states in order to play the next nearest teams. So they're doing a lot of traveling compared to just playing golf or tennis at a local park. So taking those kind of things into consideration as well. And if you need help with the financial aspect, there's a lot of individual grants opportunities out there that you can reach out to and find that can help pay for travel, that can help pay for equipment. And a lot of times the specific programs that you're working with have opportunities for financial assistance and scholarships. And then I think the other piece is if there's any medical clearance that's needed, depending on your child's condition, and just working with your medical team to figure out what is going to be the best fit for them.
Awesome. Thank you, Megan. Kathleen, I'll turn it over to you.
Great, thank you. The other things I would add to all of that is you could ask the program in terms of program considerations, besides the specialties we've talked about, but you might say, on a typical day, what's the ratio? My child has these needs. Will they be partnered with one staff member or with a staff and a volunteer? I actually had someone yesterday bring me their loved one who has a new spinal cord injury, and I was getting him set up on a hand cycle. He's a quadriplegic, and somebody said, well, are you going to send anyone out with him? Like, of course I'm going to send somebody out with him. So you might ask, like, what's the setup? What's the ratio like? You also might want to know, can I go out with my child on the first day? Like-minded organizations, if mom says to me, it's going to go better if I can go on the bike ride, of course, bring your bike. So that might be a factor. You want to bring the siblings. We love that because then everybody gets to play together. So just see what's feasible on that end. And then in terms of your child's needs, definitely like what are they interested in? What does your family do? But we will all field phone calls where somebody calls me and says, I don't really know what my child can do. I don't know what's possible. So we're going to start simple. I'm not going to take them downhill skiing the first time if I can help it. Maybe we're going to go on a bicycle because you've been on a stationary bike. So you're going to start with success. You're going to hook them into the program. You're going to put them in a schedule when they can be with other, preferably other children, and have a really nice first time, because then they're going to be more likely to come back. So they might say the long-term goal is I take them therapeutic horseback riding. Great, I don't know what the balance is. Let's start over here so we have a little bit of a progression. So I think those are my main talking points.
Wonderful. Thank you, Kathleen. And last but not least, did you want to add anything to that, Kaja? Oh, I think you're on mute.
Mute.
There we go. I'm not sure what I could add. I think Katie, Megan, and Kathleen touched all the bullet points of knowing what sort of equipment is available or to buy that program, thinking outside the box, expanding your child's perceptions, maybe somebody that might really want to ride an upright bike, but try something else. Try a really cool, fun KMX, three-wheel low recumbent bike, or try a hand cycle. Just that, ask around about what's available, know your child and what their preferences or desires are, what your family's goals may be. Is it team sports, or is it we want to all go out cycling together or playing golf together? And then being willing to be flexible or think outside the box and maybe challenge your child just a little bit and see if we can stretch this way or that way a little. I don't have much else to add.
Well said. Thank you all. I think those are some really great points. Moving to our next question that's come up. It is, as a parent, what question should I be asking to best advocate for my child? And for this question, Megan, I'll ask you to start, if that's all right.
A lot of, thinking about this question, it kind of goes back to the previous one a little bit of what are some of those things that are of interest to your child. I guess one thing that comes to mind is the activity to play, to learn, or to win? What motivates your kid? And giving as much information about your child to the coordinators so that we can help guide you to the right activity that's going to be the best fit. And I love where Kathleen says, like, let's start small, let's start easy, let's start with success and then go from there. And oftentimes it's when you try one activity that's going to lead to another, which is going to lead to another, and that kind of thing. Is there, same questions as before, is there trial equipment available? Can you come out and give it a try for the first time? We don't really want to commit. We're not sure if they're going to like it or not. Can we just come out and give it a try? And I think, most of us, all of us are going to be able to say, absolutely. That's a really important part of adaptive sports, is just giving it a try. We don't want there to be a big financial commitment, a big equipment barrier that's going to come in the way of your child participating in the activity. So oftentimes you'll find that especially more established programs will have the adaptive equipment available for your child to give it a try in. And then what other resources are out there to help fund participation? We know that these programs aren't cheap. We also understand that you may have a lot of other financial burdens or healthcare costs that are on your family. And so what other grants, scholarships, cost sharing opportunities are there in order to come and play?
Awesome. Yeah, that's a huge one. Thank you, Megan. Kathleen, I'll turn it over to you.
All right. The other thing, these are all looping back on one another. I totally agree. But in terms of therapeutic goals, So if you are comfortable and want to facilitate a conversation between the adaptive sport program specialist and the PT or the OT or someone else, that gives us more information. So you're advocating, these are my child's strengths, these are my child's weaknesses, which sport am I starting with? And then I got to know how to best set up that first day you come out for equipment based on everything you tell me. I bet we could all tell a story or two about a family that fills out something online and they forget to put in something like PTSD, my child is afraid of the water. And when I had someone for the first time at kayaking, and she says that as she's pulling away to go to Dunkin' Donuts, that's a terrible feeling. True stories, and nobody does any of this purposefully, but full disclosure is really useful whether it's behavior or physical or et cetera. We're going to ask about skin issues. We're going to ask about shortness of breath and cardiorespiratory status, things like that. So just remember, the more full picture you give us of your child, the better we can steer you towards a safe, successful issue. It sounds like you've touched a little bit already about the different requirements for different sports, but if you're calling and your child relies on a ventilator, then I can't bring them out skiing with me at most mountains, but I'm going to steer you towards a sport that's more appropriate. So I'm thinking more of the clinical pieces that need to be shared.
Absolutely. And I think that's, again, why it's really great that you guys are here, being involved in kind of both sides to help provide this information. So thank you, Kathleen. KJ, I'll turn it over to you.
I think Kathleen's last point is, are there any hard stop essential eligibility criteria that we need to know about? Again, something like a trach and water sports are not compatible. So to try and set up a child for success, I think knowing some of those things. And then when I think about this question, I think about how do I best advocate for my child? Kathleen mentioned something really great about be really upfront with us. How can we best work with your child to be successful, for them to have fun? Because for children, sports is fun. It's learning, but it's also interaction. It's getting out there, being active. And so how do we best create that environment for them? If there are certain ways to communicate with your child, give us those tips and tools. If there are my kid likes hitting milestones, great. That's so good to know, because I know this really cool bridge down there, and if we get to that bridge, then we've hit that milestone. And then if you find yourself at a program that maybe doesn't have that right equipment, don't be afraid to ask further questions, ask leading questions. What else might there be out there? Is there another program? Do you know of another piece of equipment that might be better fit for my kid? How might I find that? How could I maybe try that? Is there something, cycling isn't quite for my kid, but they might really enjoy sailing. Do you know of a program? And I guess this goes back to that first question of what do I need to know, and don't be afraid to keep asking questions, keep leading the conversation to find what is best and what your child might enjoy. And all of us here on this panel want to really provide a really fun, exceptional, active experience for everyone.
Great, thank you so much, Kaja. Katie, did you want to add anything else to this one?
Everyone covered it pretty good, but I think just in general for advocacy, everyone in this field knows that we don't want any type of disability to hold someone back from having an active lifestyle. And I think as a parent, there's so many things going on with medical and school. I think being able to advocate for your child to participate in sports starting at a young age is just really important. And being able to speak to the benefits of that. There's social benefits. Your child can gain self-confidence. They might be able to participate in a sport with another peer. They can gain independence. And being able to verbalize that with the treatment team so that everyone is in support of advocating for the child to participate in sports, I think is important for a parent to be able to do.
Oh, I was on mute. Thank you very much, Katie.
Sure.
All right, thank you all for your insight there. The final question that we have here before we jump into the Q&A is, what should be communicated between my child's medical team and their sports team or program? And Kathleen, if you wouldn't mind, I'd love for you to start with this question.
Unmute. So we've started to talk about this a little bit. The biggies that come to mind right away is any medical status changes, especially if you filled out the application or you signed up for My Sports in March and I'm seeing you in July and there's been a change in muscle tone or spasticity. If there's been a change in medication that would affect muscle tone and spasticity. What about seizures? That's a really big one. Has there been any seizure in recent, really we're thinking 3 months. Has there been anything different? Has there been an occurrence of a seizure or a change in the meds? Those are really significant for us. But really think about the meds, the medical status, any hospitalizations that may have already not been reported, any concerns your physician or therapist might have. I've had therapists call me and say, you know what, in general, yes, this person is able to ride an upright bike, but in the last month, the heat is throwing that person off, so this may not be their best day. Can you try a seated bike? So, you know, all of us in the field, we do our best to walk up and meet and greet you and say, what's today like? Because we all have good days, bad days. But when you start, you're going to want to say hasn't slept well this week because there's a newborn in the house. Well, that's a factor. So little things, so leading up to the event and the day of the event can be really important. The other point I might make for medical team, and I don't know if this differs by different program, but the only people that need full medical clearance from a physician for our programs are people that are inpatients. So obviously the doc needs to clear them. And then sport specifics. For my clients to go horseback riding, the doctor needs to sign off and make sure, like if a child has Down syndrome and there's some instability at the upper spine, we need to know that because that's a significant medical precaution. And the other really common one is for 1 year after a spinal cord injury or spinal stabilization surgery, the physicians need to be aware, as many of the sports, there's certain clearance that needs to happen. So those are kind of my red flags and my pink flags to be aware of.
Great, thanks, Kathleen. It sounds like a recurring theme is there's no over communication. Communicating is super important, so never think that you're telling too much.
That's right.
Awesome, thank you. And KJ, I'll turn it over to you.
All right, I don't think there's much more that I can add, except maybe if you're new to approaching an adaptive sports program, reach out to both your medical team and the program itself and say to the medical team, is there anything from your standpoint that I should communicate or that you would like to directly communicate to the adaptive sports program? And then ask the same question of the sports program. Is there any particular information you need from me or from my child's medical team before starting? And just open those lines of communication.
So great point. Thank you, Kaja. Katie, did you want to add anything to this as well?
I think things have mostly been well covered, but I wanted to just mention that most programs should have some type of assessment or paperwork that individuals would complete beforehand. I know we have a pretty lengthy application and it asks all of those questions. So it's a nice guide for any of our new participants to be able to go through and communicate with us. You know, it touches on their physical status. You know, are they ambulatory, wheelchair level? What adaptive equipment do they use? Their medical status, any allergies, seizures was mentioned, that's important. Any red flags that we need to know of, autonomic dysreflexia or anything like that. And then it goes into also communication. Are you able to communicate with the instructors, make your needs known? Do you have any difficulties with learning new things? Vision, hearing, it basically goes through everything. And the more you can tell us, the better it is for us to be able to meet the needs of your child. So again, same thing that everyone is saying, but that assessment form is really important to get all the information on there. So once we get our assessment form from a new participant, what part of our process is to either at least call the person, and best case scenario, if we can meet you on a one-to-one basis and, you know, ask you questions and go over all of your individual needs and what your goals are, what sports you're interested in. That gives us, you know, the information we need to kind of move forward with adaptive sports programs.
Absolutely. Thank you, Katie.
Sure.
And Megan, I'll turn it over to you if there's anything else you'd like to add.
So just one final thought on just kind of communication between the sports and your medical team is we've had a number of our PTs that are seeking more information to learn more about the sports, and they want to help their clients. And so thinking about what are things that you might be able to work on in your PT session that's going to help you out on the court. So wheelchair propulsion, for example, or trunk stability, or, you know, if you get knocked down in your wheelchair, being able to physically get yourself back up. So things that you might be able to work with your providers on during a physical therapy or occupational therapy session that's going to translate into more skills when you're out there playing sport.
Awesome. Thanks, Megan. And might even be more motivation for somebody to complete their PT if it's directly relevant. Great point. Thank you very much. So now I would love to turn it over to the attendees to submit any questions that you guys have. You can do that through the question and answer feature at the bottom of your screen. And we'll go ahead and pose this to our panelists. So one question that we have had come in so far, this is a great one. Can I use rehab hospitals and staff as a resource when trying to get into school sports? Or do you have any tips and tricks when it comes to this particular topic? If anybody in particular would like to speak to this one, feel free to chime in.
Oh, am I on mute? No, I'll chime in. I'll get started. I think certainly starting with your medical team is a great place to start if you have any questions about how to get involved in sports, whether it's through the schools or through another program. And if schools ever have questions on how to include your child, to open up that dialogue and have a certified recreation therapist or a physical therapist or somebody reach out to your school sports program and discuss some of the options. We have a lot of great ideas. We have a lot of knowledge and experience in where adaptive sports fit in at schools. What possibilities there are, because there are a lot of them. And some schools might just need a little nudge thinking outside the box of their comfort zone. So absolutely, that's that collaboration that started this conversation of how to educate and involve everybody.
And the other thing I would add to that is some districts and some regions have an adaptive phys ed professional. So we all love being the connector. So if you have a relationship with us and a relationship with the school, so if you can bring everyone to the table from the special ed team, if you're lucky enough to have an adaptive phys ed person, wonderful. So the education goes both directions. And, you know, to piggyback on what Kasia was saying, I've been invited into schools to run wheelchair basketball games because there's 2 kids in the school that want to try it. And the other kids who are able-bodied are so excited and want me to come back tomorrow and the next day. So it can be an equalizer. It can be great for the entire community to see a couple of students as more athletic because of what they are doing. So yeah, building that team, it's very appropriate for us to be involved with the school system as possible.
And just one more thing to add, we loan a lot of equipment to schools or to individuals that are participating in their own high school sports. So that's something else to consider. If the school doesn't have that accommodation of the adaptive equipment, that's something that, a program or a rehab hospital may have access to in order for your child to be able to play the sport.
Awesome. Thank you very much. Another question that we've had come in is, am I responsible for getting my child additional medical care in community programs, such as aides or nurses? Who is typically responsible for that support?
I can jump in and speak at least for our program. Because of our staffing and our training, we do actually ask that if somebody in our program, a participant, requires personal self-care, that they bring along either a family member or an aide or someone to help with that. Just as far as the number of people that we have and the training that we have, we don't feel that we can really meet that need safely for all the individuals in our program. So we do ask for that. Now, if it's something like if it's a simple task and someone needs help, like putting their ski jacket on or something like that, we're obviously super willing to help out with things like that we can. But if it's a little more involved and involves more one-to-one type care, we do ask that they bring someone along for that.
The other thing I might add, that was a good example, clothing and snacks and food and meals. I think the hardest parts are accommodating meals and then toileting. If the aide or the child feels better, or the parent feels better for you guys to do the transfer and we don't do the transfers, that's fine. But otherwise, the expectation is that we're using our expertise to help with transfers.
Great, thank you guys. Another question that we've had come in is, as a soon-to-be occupational therapist, are there any recommendations you have regarding effective ways to get a child with a disability involved in adaptive sports who is not practicing in a setting with a robust adaptive sports program within the clinical setting? I can repeat that again if that's helpful. I'll read it one more time. As a soon-to-be occupational therapist, are there any recommendations you have regarding effective ways to get a child with a disability involved in adaptive sports who is not participating in a setting with a robust adaptive sports program? So if the hospital doesn't have a robust adaptive sports program.
This is just one idea, starting out small. During your OT sessions, pull out a basketball and just throw some balls around. Incorporate recreation into your therapy and make it fun, and give ideas and things that they can do as a family, that they can do at home together, that they don't necessarily have to be a part of a larger program in order to participate.
And I would add to that, don't be afraid to reach out and not necessarily travel per se, but certainly as a PT, when I have had colleagues or friends, sorry, there's a printer here, outside of our network, and people are hesitant, like, oh, I don't want to send these clients to you. Like, I'm not going to steal someone else's therapy, but if your hospital network is not offering these sports, by all means, like, get online, find out what's possible, because it may be that the family's willing to travel a little bit, even if it's just once a month. In a region like that, it's even harder because families have no idea what might be possible. So you're doing everyone a favor to do that little bit of research and asking around to introduce the concept to them. The internet is a great tool for that. Look, there's a kid just like you who's doing, wheelchair racing or whatever it is. So you're kind of planting the seeds, and then seeing where it goes.
I also, to build on Megan's great ideas of bringing sport into the therapy, using those items, whether it's holding on to a hockey stick, or I've heard of somebody that's taken a real banged up kayak and they cut it. And so it's pretty much just the kayak seat, and the therapy is getting into the seat, you know, getting into the boat and getting back out again, or holding on to the paddle and doing the movements right in the office. And to maybe pull some intrigue, whether it's having a cycle in the office or something that you can push on, or just play with different sports equipment that could be part of the therapy, and see what interest sparks.
Those are all awesome ideas, and we're able to do a lot of that here since we work so closely with our outpatient therapists. You know, giving the therapist some ideas on some sports that they like and being able to incorporate that into therapy. But another great resource, if you're not sure what kinds of modifications or adaptations are out there for a specific sport, is on the Move United website. They actually have programs and sports listings and an awesome write-up on that sport, all about what the sport is, the different types of equipment, how to get involved. So it's a really nice resource just to learn about the adaptive part of a particular sport if you want some ideas.
Thank you, Katie. And we can also send that link in the follow-up email to give you guys a reference point. Awesome. Along the lines of equipment, we had a question come in about when participating in a program, do we need to bring any of our own specialized equipment?
Would you repeat that, Kayla?
Yep. When participating in an adaptive sports program for the first time, do we need to bring our own specialized equipment? This is a broader question, but you guys can speak specifically to your programs.
I know for our program, any of our introductory clinics, we have all the equipment needed. I think most sports programs are the same as long as they've been established for a while. But you know, archery, golf, cycle, anything like that, we're gonna have the equipment available. But again, one reason it's important to do that assessment so that we can get to know what that person's needs are. And through that, we can start thinking about what adaptive equipment is needed. And if there's something we think we don't have or, you know, might need, we can certainly talk to that person about it. But there's so many different ways to do everything. We pretty much find a way with the equipment and resources that we have. Once someone has been participating in a sport for a while, like say some of our competitive teams, once they've been on the wheelchair rugby team or sled hockey team for a year, you know, they can borrow our equipment for the first year or two. A lot of times athletes prefer to get their own equipment that fits them better and is specifically built for them.
And I would just have to add that we actually encourage, especially for kids, to use our equipment, because we don't want you to make that financial investment in purchasing a big fancy piece of adaptive equipment without knowing, is this going to be the sport of choosing for your child? So, and also your kid is going to keep growing. So, you know, hopefully, you know, that's the kind of the other thing too. So use our equipment, get established. If there's things that you like or things that you know work really well for you, like if you have specialized grips at home or, you know, a certain seat cushion or something, you know, bring those with, you know, let's incorporate that in. But, you know, oftentimes we'll have a lot of what we'll need.
Great, thank you, Megan. And I know, just like you guys were saying, one of the great bits of adaptive sports program is that often there's a collection of equipment that individuals can try. So as you were saying, just repeating, recommending participating with that organization, figuring out what equipment works. And then once you figure out what works, maybe seeking grant opportunities, whether it's through Move United or different organizations, to be able to purchase that equipment, because we recognize that that's absolutely one of the barriers in the adaptive sports world. Adaptive equipment is very expensive. So we're fortunate that we have these adaptive sports organizations to help figure out what works and what doesn't work for you all. So we've had another question along different lines come in. It says, how do I connect with other parents? Are there support groups? So it'd be great to hear from each of your perspectives if this is something you've encountered, been asked before, and if you have recommendations for parents asking this question.
Sure, I'll jump in and start. I think there are a lot of support groups out there. There are a lot of sort of diagnostic specific support groups, which is a good place to start. One of the really neat things about our adaptive sports programs also is that often there's cross-pollination when people come for a session and there are other families there, other folks and participants of all ages there. The conversations and the bonding that happens, the little bit of community that happens on site is pretty fun, and it's intergenerational and as well as cross-diagnostic. But even if participants go out in sport and family members stay back and start having conversations, or you're all there together, I think there's a lot of support that happens right through an adaptive sports program as well.
Great, thanks, Kaja. And I know we're coming close on time here, but another great question we've had come through is, my kid has high or more intensive medical needs, and I want them to participate with peers in certain sports, but currently the programs don't allow it. Do you have recommendations on how to get their child involved in sports with their peers?
If I understand the question right, it may be that the sport organization doesn't have enough equipment, and now we're all struggling with social distancing and space. But again, I think it's worth doing the research and finding out if there are certain sports, like for our wheelchair basketball, we often have enough chairs at certain locations or certain nights of the week where we welcome peers to come in. So I think it's digging a little deeper, because I agree, I really believe most organizations, that's our end game. We want children to be recreating with family, with friends. So maybe it's starting small and saying, every other time my kid comes, could they bring one friend? But I suspect it's more about space or availability of equipment. The other thing I've done is said, I'd love to do that, but it's a busy night. Could you wait and call me the morning of and see if I have an extra chair for you or an extra, piece of equipment? So sometimes it's a wait and see. And then if another participant cancels, then by all means. So don't give up, but keep trying to make it happen.
I think another part of that also is trying to pick the right sport for that inclusion to happen. So, can we start something with wheelchair soccer or bocce or some of those sports that are really adaptable to people of any ability, and trying to make that the sport that's inclusive with the peers. That could be another way to go about getting everyone together for the same activity.
Awesome, thank you. And again, thank you all for your insight and providing some insight into your experiences here. Before we wrap up this session, I'd love to turn it back to you guys to see if there's any last minute topics you guys want to cover that we haven't yet covered. Awesome.
I have one quick thing. We've talked a lot about some grants and funding, and I wanted to mention a popular grant is called Challenged Athletes Foundation that a lot of our athletes utilize, and they award a lot of grants every year, specifically for adaptive sports equipment. They don't always allot the entire amount, but they're able to give some pretty nice grants to people to help them get active in sports.
Yeah,
just
absolutely.
One more to add to that list that we've had a lot of success with lately is the United Healthcare Children's Foundation. So they will give up to $10,000 in a child's before they're age 18 for things that aren't covered by medical expenses. That could be swim lessons, it could be catheters, it could be training fees or additional PT sessions. It could be adaptive equipment. So it's a pretty wide range of things that it covers. It is based on financial needs, so sometimes it doesn't hit everybody, but we've had a number of athletes use that to purchase adaptive equipment or pay for some of the fees to be able to participate in programs.
Yeah, absolutely. Thank you for sharing that, those Megan and Katie. You know, grant opportunities are huge. And again, in the follow-up email, I'll share some of the Move United grants. But like Katie and Megan have mentioned, there are many, many opportunities out there. And we do have some of those listed on our webpage as well that I'll share that link so you can kind of find what works best for your athlete. So thank you very much.
I think the last thing I'll remind everyone is to rely on the internet for when you're thinking about sports that your family or child could get involved in. Again, if you don't have anything in your backyard locally, you may not know there's a sport called power soccer that someone that uses a power wheelchair could access. So often, because kids are so visual, they see other kids out there playing. So that's another one to entice them and get them interested in a variety of different sports.
Awesome. All great points. Thank you all so much for joining us today. We really appreciate you taking the time and sharing your resources. As a reminder to those who are tuned in with us, we do have one more session scheduled in 2 weeks that is called Your Child is Transitioning, How Are You? And that is focused on the transition from high school athletics to college athletics, so how an individual can support their athlete in that transition. And finally, for those who aren't yet aware, Move United does currently have an Adapt at Home webpage with several virtual events that have been logged from different organizations all across the member network and outside the member network. So if you're looking for something to do to stay safe, connected, and active, you can feel free to check that out here. And in addition, we've recently launched a new initiative where we're giving out free Adapt at Home fitness kits. And those include items like cordless jump ropes, kickballs, there's exercise bands, a whole slew of things. So if you or somebody you know who has a disability is interested in that, you can go ahead and go on this virtual Adapt at Home webpage and you can register there. And we'll send that in the follow-up email as well. But thank you again to everybody who's joined us. We've had a wonderful time and hope you enjoy the rest of the week and tune in with us next time.